What to expect from your first session of pelvic floor physical therapy. First of all, don't be nervous. I know a lot of people are nervous. They don't know what to expect. It's a safe space. You can do whatever you feel comfortable with. Your level of comfort is the most important thing to us. The first thing that a pelvic floor physical therapist is going to do is ask you a bunch of questions. We're going to ask about your symptoms. We're going to ask when the symptoms started, what makes it worse, what makes it better, what was happening in your life during the time the symptoms started. Questions along those lines. We're going to ask about your gynecological history, your menstrual history. Did you have difficult labor and delivery? How many pregnancies did you have? How big were your babies when you were giving birth? We're going to ask some questions about sexual health as well to find out if these issues are contributing to your symptoms. The next thing we're going to do is an evaluation. This starts off externally. It can stay externally. You don't have to do the internal portion if you're not comfortable. First, the pelvic floor physical therapist is going to evaluate your hips and your pelvis to see how your joints are moving and seeing if there are muscle imbalances or joint restrictions. The next thing we might do is an internal exam. This is if you are comfortable with it. We want to check the quality and tone of the muscle, how well you contract the muscle, how long you can hold the contraction for. We're looking for trigger points, nerve sensitivities, and things of that nature. The next thing we would do is educate you. Educate you on things that may be contributing to your symptoms. Things that you can easily fix. Maybe something you're eating or drinking may be contributing to your symptoms. Maybe the way you sit at work could be contributing to your tailbone pain. These are things that we can help you to accommodate and improve your symptoms. We'd also be giving you some forms and questionnaires to get a better idea of your symptoms and your condition. We also want to be able to compare it with your final session to see how much you've improved. The last thing we do is give you some homework. So we would teach you some exercises, some safe movements to do, and give you a handout with pictures and instructions so you can continue to do these exercises at home during the week before we see you again. So this is basically what your first session would be like. Again, it does not have to be scary. We do not use anything like speculums. We don't take tissue samples. We generally don't use needles unless someone does dry needling, but it's not very scary. We're very nice people. So if you have any questions, just reach out to your pelvic floor physical therapist and have them fill you in on what the session would be like so you feel as comfortable as you can before you start pelvic PT.